Governor Cuomo, what do you make
See ya.
of the accusation that the committee is making that you withheld some records during the course of their investigation?
All baloney, as we would say in New York.
Do you expect any difference from the transcribed interview earlier in June today?
Thank you for signing my bill, Mr. Cuomo. Marcella.
Nice to see you.
Nice to see you too. Sir, are we going to drop the immunity?
Mr. Cuomo, welcome. I want to thank you for your willingness to participate in today's hearing and for testifying in front of the Select Subcommittee more than 2 months ago. It took issuing a subpoena to get you to then agree to testify previously, so I appreciate you coming in voluntarily today. Before we get into the substance we are here to examine, I want to tell you that this subcommittee has been threatened twice this Congress. Once by the Chinese Communist Party through its embassy for examining the origins of COVID-19. And a second time by you through your counsel for examining the handling of COVID-19 in nursing homes. I can tell you, we have not and we will not bow to these threats. I certainly hope you do not approve of these tactics, or perhaps you aren't aware of them, Governor Cuomo, which seems to be a consistent pattern. Nonetheless, Select Subcommittee is holding this hearing today to examine your administration's handling of the COVID-19 pandemic in New York. Specifically, we want to focus on the issuance of a directive that resulted in the admittance and readmittance, according to the AP, of more than 9,000 potentially COVID-positive individuals to nursing homes. The Select Subcommittee has been authorized to investigate the COVID-19 pandemic and to explore lessons learned, positive or negative, to better prepare for future pandemics. Since the beginning of this Congress, we've been committed to conducting a thorough investigation, free from influence and unafraid to follow the facts wherever they may lead. We've acted in a transparent fashion, cognizant that Americans deserve to see our work and review all available information so they can draw their own conclusions. We're examining actions taken by Congress, including measures I voted for, but might want to do differently or better the next time, so that when the next shocking pandemic occurs, we have looked back, found what worked and what didn't, and established a workable system so that we may endure. This is an after-action review in hopes of being able to predict, prepare, protect, and perhaps even prevent the next pandemic. In search for best pandemic practices, today's hearing is focused on New York and the March 25, 2020 directive from the New York State Department of Health issued under Governor Andrew Cuomo's leadership. In this investigation, we have reviewed more than 500,000 documents, and we've conducted 10 transcribed interviews with members of your administration, including you. Our findings are based on the evidence and testimonies that we have received. This is a comprehensive and painstaking endeavor to find out what happened in New York nursing homes, with more than 2,000 pages of testimony publicly released to support our conclusions. Simply put, America cannot move forward without first looking back. And that includes examining your directive, Governor. Mr. Cuomo, I think you'll agree that New York State became ground zero for much of the pandemic in the United States. In the earliest stage of the pandemic, COVID-19 was a novel virus, and there was little information and a lot of unknowns. But it quickly became clear that COVID-19 was particularly dangerous for the elderly. We all saw the deadly consequences of COVID-19 in nursing homes in Washington State, the earlier epicenter of the pandemic. There was a 1,000-fold higher risk of poor outcomes, specifically hospitalization and death for older people relative to younger populations. Therefore, it was critically important that the public health response prioritize protecting high-risk populations. This is an important lesson learned. This was understood by the U.S. Centers for Medicaid and Medicare Services and the U.S. Centers for Disease Control and Prevention, the CDC. On March 13, 2020, CMS issued guidance, I want to stress the word guidance, that specifically directed nursing homes to not accept COVID-19 positive patients if they were unable to do so safely, and to only accept individuals if the nursing home could follow CDC transmission-based guidance. Again, this guidance was a non-binding, federally issued guidance that's reflected by its language. The CMS guidance used terms such as can and should, consistent with the tone of guidance. A nursing home can accept a resident, this is a quote, a nursing home can accept a resident diagnosed with COVID-19 and still under transmission-based precautions for COVID-19 as long as the facility can follow CDC guidance for transmission-based precautions. Nursing homes should admit any individual that they would normally admit to their facility, including individuals from hospitals where a case of COVID-19 was or is present. This was not the case with the directive issued by your administration on March 25, 2020. While I know I like to play semantics and refer to it as an advisory, it's clear that it's anything but. Merriam-Webster defines an advisory as containing or giving advice. Your advisory refers to itself in the language as a directive in the very first paragraph, with your name at the top, Governor Cuomo. And it says, this directive is being issued to clarify expectations for nursing homes receiving residents returning from hospitalization and for nursing homes accepting new admissions. Merriam-Webster defines a directive as an authoritative order or instrument issued by a high-level body or official. That's what that was on March 25, 2020. In your case, that carries the weight of all. Your directive uses words like shall, must, and prohibit. It directs that all nursing homes must comply with the expedited receipt of residents returning from hospitals to nursing homes. It directs no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. An authoritative directive from the state of New York with the authority of law. No resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. It directs that nursing homes are prohibited from requiring a hospitalized resident who is determined medically stable to be tested for COVID-19 prior to admission or readmission. See, here's the problem. Medically stable can still mean highly contagious. The language in this directive is not advisory and it's not non-binding. The CMS guidance was and still is advisory and non-binding. Directive with the authority of law supersedes guidance. Prohibited means not allowed, and prohibiting testing for COVID-19 is nowhere in the CDC guidance. Because of this language, the March 25 directive was dubbed a must-admit order by the public and press, and rightfully so. Those words are not in there, but that's how it became known in the common vernacular in the public and press. But your directive was not consistent with federal guidance, nor consistent with medical doctrine. You do not put highly contagious patients in with vulnerable patients, subject to infection, and in this case, death. Your former commissioner of the Department of Health told us that you received the phone call from the Greater New York Hospital Association asking you to do something about nursing home residents that the hospitals wanted to be able to discharge. He testified that you were told that these patients needed to go home. And while you testified that you were not aware of the directive until April 20, 2020, you decided to keep it after learning about it. It remained in effect for almost 3 weeks after you knew about it. Governor, you own this. It's your name on the letterhead. This is your directive, whether you knew about it or not. You're the leader. The buck stops with you, or at least it should. It's important to look at your administration's record. 2 weeks after you learned about the order, your office changed the methodology of how nursing home fatalities were categorized. You removed out-of-facility deaths that occurred at the hospital, altering the full accounting of nursing home deaths. During your transcribed interview, when describing why you chose not to disclose the number of nursing home residents who died at hospitals, you remarked, "Who cares?" I'll tell you who cares about this. Doctors and nurses trying to save lives care about this. People dying and their families, they care about this. If someone contracted COVID-19 in the nursing home and died at the hospital, it matters. It is scientifically significant to know where, how, and why someone contracted COVID-19 and died if we're going to prevent this in the future. That is important data. In July of 2020, you released a report under the auspices of the New York State Department of Health that blamed nursing home employees rather than your directive for the deaths that occurred in nursing homes. Your spokesperson, Rich Azapardi, described this report as peer-reviewed. I'm not sure if Mr. Azapardi understands the peer review process. An effective response to the pandemic required a willingness to adapt to evolving data, to new information. It will be required for the next pandemic as well. It's important to review the data, actual data, to recognize the dangerous and disastrous consequences of your directive. A directive that goes against medical protocols and is considered by many medical professionals to be malpractice. You wrote in your book that it wasn't your, quote, place to filter or edit the truth, end quote. But it's clear that it seemed to be someone's place. You said, "Who cares?" But we do care about the truth because it's obvious that you don't like the out-of-facility nursing home deaths. It's a truth that matters. And that's why we're here today. To ask why you made the decisions that you or your executive team made. To try and account for your actions and responses without naming and blaming others, as you have repeatedly done, because we need to help America be prepared for the next pandemic and to protect American lives. And because infectious diseases like respiratory viruses don't recognize borders, we want to protect lives beyond our borders as well. I look forward to a strong, on-topic discussion today. Do you solemnly swear or affirm that the testimony that you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Let the record show that the witness answered in the affirmative. The Select Subcommittee certainly appreciates you for being here today, Governor Cuomo, and we look forward to your testimony. Let me remind the witness that we have read as much as we could of your written statement, and it will appear in full in the hearing record. As requested, please limit your oral statement to 6 minutes, as we agreed upon. As a reminder, please press the button on the microphone in front of you so that it is on, and the members can hear you. When you begin to speak, the light in front of you will turn green. After 5 minutes, the light will turn yellow. When the red light comes on, your 6 minutes has expired, and we would ask that you please wrap up. I now recognize Mr. Cuomo to give an opening statement.
Thank you. First, to the families of the victims here today and across the country, I am sorry for your loss, and I believe you are owed an apology because this country should have done better. There is no reason why we lost 1.2 million people, more than any country on the globe, when we have the most sophisticated medical system. This committee must deliver real answers so it never happens again, and I am here today to help in that mission. As you know, New York was hit first and worst by COVID through no fault of its own. I did daily briefings, and millions listened in because they wanted, no, because they needed information and guidance. And yes, I often vehemently disagreed with President Trump because from day one, he willfully deceived the American people, denying COVID's very real threat, telling us that it was like the flu, it would go away by Easter, it was a Democratic hoax, use Clorox. And his lies and denials delayed our response, let the virus spread, and this country never caught up. Trump literally said, "I take no responsibility," and he fabricated political attacks blaming Democratic governors, including saying that New York issued a health order on March 25th having COVID-positive people enter nursing homes from hospitals, which recklessly and needlessly caused thousands of deaths. And then Trump weaponized the Department of Justice, starting investigations against New York and 3 other Democratic states. Trump's shocking allegations, all false, were designed to shift blame from him to Democrats, and they did. They also created great pain, confusion, and fear for families. And this subcommittee, run by Republicans, repeats the Trump lies and deceptions, and it inherently makes 2 powerful admissions. First, their report does not deny, contrary to what New York Republicans said for 4 years, it does not deny that it was actually the Trump administration, the CMS and CDC, that first said in early March that COVID-positive people could go from hospitals to nursing homes, even if they were still infectious. That was your ruling. The committee attempts to argue that the New York advisory didn't follow the CMS guidance and overrode safety laws. But that has already been investigated by the New York Attorney General, who said you're wrong and who confirmed the March 25th advisory was in total compliance with federal guidelines and that all New York's nursing home laws remained in effect, period. In addition, the report provides no evidence to support Trump's main allegation, repeated for 3 years, that New York's guidance killed thousands in nursing homes. In fact, the report finds no causality whatsoever, not one death, all hype. Why? Because it never happened. All credible studies now say that COVID came into nursing homes through community spread and infected staff, not hospital admissions or readmissions. Numbers don't lie. 35 states had a higher death rate in nursing homes than New York, including Ohio. Most Republican states actually had a higher death rate in nursing homes than New York in 2020. And that fact damns them and reveals their hypocrisy. But these are all diversions to blame New York and other states for the culpability of the federal response, which was malpractice. There was no preparation, no PPE, no testing, no masks, no science, no leadership. As one Republican governor said about Trump, the general was missing in action, leaving 50 states bidding against each other for scarce medical supplies. It was the COVID Hunger Games. The federal government was nowhere to be found. New Yorkers remember well those traumatic days when the only sound that echoed through the empty streets were the constant sirens from ambulances, when mass graves were being dug on Hart's Islands, when bodies were being stored in refrigerated trucks. Our hospital system nearly collapsed, and Trump was threatening to send federal troops to blockade New York so no one could leave. That was the federal response. And yes, New Yorkers were scared, but they were New York tough, and they showed that they responded to government leadership when they believed it was based on facts. In that moment in New York, there were no Democrats and Republicans. There were just New Yorkers helping and relying on each other. They were guided by their better angels. They followed science, took vaccines, wore masks, and acted responsibly, one for another. New Yorkers' heroic actions brought us back from the brink and saved many, many lives. When COVID started in 2020, we had the highest death rate in the country. But at the end of 2021, remarkably, New York had a lower death rate than 30 states. But even with all New Yorkers did, we lost far too many. And I'm sorry for every life lost. In closing, I know this is a political year, and I have testified before many, many congressional committees. But this issue really matters. There will be another pandemic, and they will pull out your report for guidance. I hope it has real answers. God forbid 1.2 million people died in vain. Thank you.
And just as a reminder for the public tuning in, we are here today on behalf of the over 15,000 vulnerable seniors in nursing homes who died because of Governor Cuomo's fatal executive order on March 25th, damning them to this horrible fate, including constituents in my district and every congressional district in New York State. I also want to recognize the families and advocates who have been working tirelessly on behalf of their loved ones amidst this grief, who have been smeared, attacked, and denigrated by Governor Cuomo and his most senior aides. Let me begin first. After months of inquiry and investigation, we now know irrefutably what New Yorkers have known for years, that Governor Cuomo himself and his most senior aides ordered, directed, and executed this deadly executive order counter to CMS and CDC guidance. Our investigation also reveals, a bipartisan investigation, that the disgraced former governor and his top aides were caught covering up their culpability and guilt to selfishly save their shredded reputations. I want to start with the March 25th directive. Isn't it correct, former governor, that Dr. Zucker served as your commissioner of health during the COVID crisis?
Yes.
And you have stated and shared that you have great respect for Dr. Zucker's work and professionalism. You have said that in the past. Is that correct?
I don't know if I've used those words, but I'll take your word for it.
Do you have respect for Dr. Zucker and his professionalism? Yes. Are you aware that Dr. Zucker testified that the March directive was prompted by a direct request to you, former Governor Cuomo, from the Greater New York Hospital Association? Are you aware of that fact?
I'm not aware of his testimony, no.
Well, that was what he testified to this committee. Dr. Zucker also went on to say, quote, Greater New York Hospital Association called the governor and the team. We were all there in a conversation, end quote. I also want to add, are you aware that another staffer at the Department of Health testified that the March 25th order did receive sign-off from the executive chamber? Are you aware of that fact?
No, I'm aware of the testimony to the exact opposite that you received.
That is incorrect. He said, yes, absolutely.
That's not the testimony that I have before me.
The testimony I
Mr.
have
Hutton,
before me, when he was asked whether the March 25th order was signed off by the executive chamber, the answer was yes, absolutely. And on top of that, Dr. Zucker testified that, quote, everything goes through the governor's office. And by the way, Governor, you and I both know that under your terrible leadership in New York, everything does go through the governor's office. My follow-up is it wasn't just the directive itself, Governor, it was the cover-up. Yeah. This investigation found that you, former governor, and your most senior aides made a deliberate decision to exclude certain COVID-19 related nursing home deaths, to hide and undercount the actual mortality rate in nursing homes. And for the public, Governor Cuomo changed the methodology of counting nursing home fatalities to exclude out-of-facility deaths, to undercount those. I want to ask you, what period of time were you negotiating for your book deal?
Congresswoman, if there is a fact in what you said...
No, I'm asking you a
was there by
question.
mistake.
I'm asking you a question. What dates did you negotiate for your book deal? That is the question before you today.
I'm answering a question that
No.
you asked.
The question that I
My
asked...
testimony says, during
No.
that time, did you have any discussions with the executive chamber regarding the need for guidance?
That's not the testimony
Not
I'm
that
referring
I
to.
recall.
Absolutely
Not
was the
that I
answer.
recall.
Governor, absolutely. You're throwing your staff under the bus.
Also-
You are culpable for this. My question to you is, when were you negotiating for your
Also-
multi-million-dollar advance deal for your book as seniors were dying in nursing homes? That is
Also-
the question in front of you.
You can't make up facts, Congresswoman.
You're the one making up facts. You're the one who undercounted
Attorney
nursing home
General-
deaths. You're the one who I want to ask
The
right
Attorney
now.
General said
You
the exact
apologize today,
opposite.
but there are families sitting here. I want you to turn around, look them in the eye, and apologize, which you
This
have
is no-
failed to do. Will you do
Congresswoman,
it?
This is not about political theater. It's
No,
about
this is
giving
about
answers.
accountability.
Why did 1.2 million Americans die? Why did more
Why
Americans
are
die
you?
than any
No.
country on the globe?
You're the former governor
Why
who's
did you let
disgraced
the
under oath.
president
No.
lie to the
This
people of the
executive order was
United
under
States?
your name. It was counter to CDC
Why
and
did you let
CMS.
President Trump lie?
This is about those seniors,
understand
Governor.
you were
They
running for
deserve
vice
to
president,
hear from you
but
in
you
the
should have
eye
stood up
that
for
you
your
apologize, that
constituents
you were
first.
negotiating for a multi-million-dollar book deal. It is a disgrace. There is a reason why you were the former governor of New York State, and you will never hold elected office again. I yield back.